A pleasant day and a warm welcome, ladies and gentlemen, to your favorite medical discussion I made. Throughout the program, we were discussing about many conditions that were helpful for you and that will be helpful in the future as well in order to identify certain disease conditions. So we are giving this sort of a knowledge to early diagnosis and even identify a certain condition as early as possible, because some conditions, even today what we are going to discuss, leprosy, is all about early diagnosis. So without moving to any mechanisms other than that, if we contract the disease, if we can identify that particular disease on the early stage, very first years of progression, we can limit and we can move out of those consequences which will affect later on. So moving to today's program, leprosy, focusing to the community aspect, we invited Dr. Dilini Vijayasekara, consultant community physician of anti-leprosy campaign. Thank you very much, madam, for accepting our invitation to join this discussion at IMED. So madam, we'll be focusing today on leprosy as well, but more on to epidemiology. So what can you comment about the epidemiological condition of this leprosy?
Yes, when you talk about epidemiology in leprosy, annually in Sri Lanka, nearly 2,000 new cases were being registered for treatment. All these patients were registered for multi-drug treatment in the dermatology clinics in our hospitals. Now, from where these 2,000 are coming from, nearly 40% of the patients are coming from Western province, mainly Gampaha, Kurunegala and Kalutara. And the rest, nearly 15 to 70% annually, we will be finding from Eastern province, mainly from Batticaloa district. And apart from that, nearly 10 to 15% of the patients we are identifying from down south, from Galle and Mathura, and of course from northwestern province and north central province. If I to tell in districts from where most of the patients are popping up, mainly Colombo, next Gampaha and Kalutara, Batticaloa, Galle, Mathura and Puttalam and Polonnaruwa, Anuradhapura and Ratnapura. Those are the districts. If you consider about the case load, new case detection for the past 10 to 20 years, those are the districts higher number of patients were being identified from the past.
Right. So madam, what is the reason for those areas to be identified as a high number of persons emerging, patient emerging capacity?
One thing is the population density. You know, in Western province, the 3 districts, the population density is much more. And of course, the down south and the other mentioned district also, the population density is that much. And this leprosy, it's a disease of poverty. Why they are saying it is disease of poverty? Because of the mode of transmission of this illness. The mode of transmission, this transmit via respiratory droplets. Now, if you are to live in a confined environment where little bit of ventilation is there and people are living crowdly, those kind of settings are more in Western province and the previously mentioned districts. Because of that thing, I think more and more number of cases we are identifying from these districts because of the mode of transmission.
Right. So that means the living condition, the environment, the infrastructure facilities available, they all contribute to the progression of this disease.
Yes, and the other thing, for identifying the patients, for the diagnosis, most of the facilities are higher in these districts. Maybe because it is one of the reasons why we are diagnosing most of the people from these districts.
Right. So madam, apart from that population density, and when people are living closely packed together, even in confined environments, even if there is a particular person, as we discussed in the previous episode, that exposure for 3 months, 20 hours per week, that condition. So apart from those things, so any other conditions, environmental or any other physical or chemical or whatever exposure that will lead to this disease?
At the moment, I would say no, because now that the causative organism, Microbacterium leprae, it's an intracellular one. You can't grow this bacteria outside. That is why this much of time has taken to identify effective treatment and those things. Therefore, apart from that thing, because of the mode of transmission, I told you, because of that thing, most of the time that prevalence is more in this kind of this part of the country. Apart from that thing, because of the nature of the bacillus and the way it can survive, we can't figure out and say these are the favorable things and these are the not favorable things for this disease.
That means, madam, from a living patient, that means who have contracted the disease and have the ability of transmitting that disease, is only the place that where one person can get the disease.
Most of the time.
Right. So even when it comes to that disease condition, sometimes from human beings they can be transmitted to animals, and from back to animals they can come back to the people. So is there any mechanism related to leprosy, madam?
Not in Sri Lanka at the moment. In Sri Lanka, for the time being, we know, as far as we know, the bacillus is with the patients. But in other countries, in USA, there's a creature called nine-banded armadillos. The research has shown that they are harboring this bacillus. Apart from that thing, in UK, red squirrel. Therefore, in other countries, research has shown that there are certain kind of creatures are there which are they harboring the bacillus, but at the moment, therefore, sometimes it's a kind of a zoonotic disease. But at the moment in Sri Lanka, as far as we know, we don't have such kind of animal reservoirs.
Right. So
only the people who are with leprosy are having bacillus with them.
Right. That means only people here in Sri Lanka harbor there's like the viral content and distribute that particular disease, and if they were to identify that disease particularly on proper time, they won't be spreading this disease to a certain extent to other people. So when it comes to the discussion of the anti-leprosy campaign, what are the initiatives? Like, are there any survey mechanisms that facilitates the collection of data?
Yes, we do have a database. We do have a database, and in Sri Lanka we are fortunate that each and every patient who are diagnosed as having leprosy will be diagnosed by a consultant dermatologist. Therefore, from there we are having a data flow and we are having a database. Based on these data, surveillance data, we are planning other activities. For the activities wise, at the moment, anti-leprosy campaign, what we are focusing is mainly 3 activities. One is the contact tracing. You know, now when we are diagnosing a patient as having leprosy at the dermatology clinic, one thing, we will be informing the relevant MOH area, MOH office regarding this patient. If the patient is willing, only we will be doing that thing. We have to tell that thing. If the patient is telling, I don't want to relieve my illness to others, therefore don't do anything, then of course we don't do anything. If the patient is saying it's okay, go ahead and do the investigation, then from the hospital will be sent in the notification to the relevant MOH office. From the MOH office, the public health inspector will be visiting the patient place, and he will see who are the other people who has contact with this patient and whether they are having any clinical manifestations or characteristics of leprosy. Then he will ask those patients to come for a further examination to the relevant MOH office. Then from the doctor at the MOH office, he will see the patient. If the patient is having suspicious lesions, then he will directly send those people to the dermatology clinic. We are calling this as the contact tracing. It is one of the method we are practicing in Sri Lanka, because now most of the people, if you see the data we are having, 81% of the people's source of infection was from their own house. from their family. Therefore, we are focusing mainly the family contacts. That is one thing, because now that leprosy is having a prolonged incubation period. Average it will be around 3 to 4 years. Sometimes the clinical manifestation will be there after 10 years after the contact. Sometimes 20 years after the contact. Therefore, what we are basically do is contact tracing. In there, we will give the proper advice to the contacts and what you have to do, even if they are not having any kind of a clinical manifestation or suspicious thing at the moment when we are seeing the patient. And the second thing, we are conducting house-to-house service or ring service. In there, what we'll do, we are looking at in leprosy, if you pop up or map up the patients for 10 years or 15 years, you will see a kind of a similarity. Because most of the people who are with leprosy, they are coming from leprosy pockets. In Sri Lanka, of course, in each and every district, they know from where the majority of patients will be coming up. Periodically, we'll be conducting clinical some kind of a service in those kind of areas in the form of ring service or a house-to-house service. That is how we are going to facilitate, or we want to, at the moment what we are doing is, if we have to catch up the patients early and treat those patients, that is the way to go forward, because there's no reservoir, only the people with leprosy is harboring the disease and the bacillus. Therefore, what we are doing is we are trying to catch up the patients early as possible, and we will be referring those patients for the proper treatment. Therefore, that is the two ways we are doing to combat the illness. And the other thing is the stigma and the discrimination, because anyone, if you ask what do you want to have, whether it is leprosy or diabetes, no one would like to have leprosy. Why? Because of this associated stigma. Because people don't want to get leprosy, even though there are proven treatment are there. But still for diabetes, you have to have a lifelong treatment.
Yes.
But people say it's okay.
It's okay.
It's okay. I would like to have diabetes, but not leprosy. That's because of the stigma. Therefore, we want to break the stigma. As the campaign, we are conducting various kind of programs and the district level and the national level also. Therefore, those are the three strategies or activities mainly we are doing at the moment. First one is the contact tracing, and the second one, we are looking for newer cases, hidden cases, in the way of conducting ring service and house-to-house service. And we are conducting various kind of programs to break the stigma. That's how the people will be coming for the treatment. Otherwise, even though they may be having characteristic or features of leprosy, but they don't want to come for the treatment. Therefore, to break that thing, we are conducting those are the three strategies at the moment we are practicing.
So people might understand that in these programs, throughout what we are talking about leprosy, it's all about come to treatments and get treatments. So other than that, nothing important. Other than that, there are many things important, but the most important thing that we could emphasize is that the treatments on proper time. So that is how this disease can be eliminated in the sense. So if we have the particular contact tracing ability to a greater extent, if each and every person is coming to treatments on proper time, that would be very much easy for the betterment of the community. And even, madam, if we're talking about the community level involvement, how the general public can involve in this is about sharing this information among others and giving a particular awareness. So it's all about sharing information and even being educated about what we have like in these programs, and even involving in those types of campaigns where like the anti-leprosy campaign. There are many things that you can consider. There are many things that you can educate the public and share these information in order to prevent some other person without having treatments. If he is dealing without treatments, if he has some certain sort of symptoms, you can direct him for particular treatments, and that will be more than enough as a community level engagement in individual capacity. So madam, when moving to deeper context, if those people having certain conditions of developing with leprosy, with time he's not having proper treatments, we talked about consequences. Are there any serious consequences? Might be life-threatening conditions?
Not in leprosy. From leprosy, no one will die.
Right.
That is one reason why people are not thinking about this illness seriously. Because sometimes skin manifestation, as it is a spectrum of disease, some of the people, they will be having only the skin patches and those kind of. Some people, they will when the time goes, the disease will progress and the nerve involvement will be there. Certain kind of because of those nerve involvement, sometimes they may be losing their digits.
Yes.
Sometimes they may be having prolonged chronic wounds. Those things are there. Because of that thing, people are not feared of this thing.
Yes.
That is why most of the time, even among the healthcare workers also, from our part also, I think we are not focusing this infection. This is too much because of that thing, because the visible damage and the other thing is very much less. But for that particular patient, it's a big thing. Therefore, it's very important to know these things and to aware the community regarding this thing. And you told in you previously told what are the things a patient with leprosy has. Yes. the responsibility.
Yes.
One responsibility is, if you are having leprosy, if you are diagnosed as having leprosy, one thing you have to tell about your contacts. Maybe in our setups we know some of the patients, they don't want to relieve their illness to the others because of that stigma. But you have to understand, if you tell about your illness and if you bring your contacts to the hospital or to the MOH office, from that only you will be able to, and we will be able to catch up the new patients. Therefore, one responsibility of the people who are with leprosy, speak about leprosy, speak to the community how you get cured with the proper treatment. Therefore, it is very important to talk regarding leprosy in the community. That's the only way. That is how we will be able to break this barrier. Otherwise, we are not talking. From the health care workers also, we don't want to talk about leprosy, and the community level, the community people who are with leprosy, they don't want to talk about leprosy because of this stigma. We need to break this thing.
Right. So madam, if we were to stress more about this diagnostic aspect of leprosy, can we just inform and advise the general public about that?
Yes, mainly it's a clinical diagnosis. The doctor will examine you and he will diagnose. Apart from this, there's no blood test to confirm the diagnosis.
Right. Although, madam, interrupting in the middle, a lesion is there, reddening is there, certain sort of an infection type thing is appearing, so I need to check my blood. So a blood count or any other investigation won't reveal leprosy.
No.
So madam, although it does not reveal leprosy, is there any other manifestation from a blood report to suspect that kind of an infection or something like that?
No. For the diagnosis leprosy, there's no blood test at the moment. When we are starting the treatment, we want to know whether this disease is progression or whether this patient is going for the cure. For that thing, for the monitoring purpose, we are using triple S test, the skin smear. Apart from that thing, at the moment we are not using in Sri Lanka. What we do, it's a clinical diagnosis.
Let's move with the diagnostic aspect now. Yes.
It's a clinical
thing. So madam, proceeding with what you were telling about the diagnostic thing, stressing more on diagnostic tools and how to diagnose these patients beforehand, like condition you were talking about. So like moving to that previous aspect.
Yeah, when diagnosis, first thing is the clinical manifestation. More often people with leprosy, they will be having light color patches. Sometimes this light color patch may appear as red color or a pinkish one.
All right.
Sometimes it will be in the same level of your skin, but sometimes when the disease get progress, it will go elevate, and sometimes there will be nodular type of lesions, and sometimes some of the patients, because of the involvement of the nervous system, thinking nerves will be there. You know, in normal people you can't feel the nerves,
Yes.
but in leprosy patients the nerves can be felt.
Right.
And sometimes pain will be there, sometimes numbness, especially in the arms and the legs will be there. And the other thing, sometimes we have come across these kind of patients, they are having chronic wounds,
Right.
especially in their legs. They are not aware of their disease status. Sometimes they may be having diabetes also,
Right.
and they are going for the wound toileting, and sometimes accidentally they may be diagnosed as having, of course you are having leprosy, that's why you are having these kind of chronic ulcers, because of they can't sense or feel the thing.
Yes.
That is why these things are there. Those kind of clinical manifestations will be there. If you are having that skin manifestation, sometimes one lesion will be there, one light color patch will be there, sometimes few 5 to 10 will be there, sometimes there will be more, and sometimes the lesion is a very 25 coin size lesion.
Right.
Sometimes it will appear half of your backside will be a leprosy lesion. Therefore the clinical manifestation is vary, but skin manifestation and the nerve manifestations, and those are the things you have to think about. If you are having this kind of anything, if it is not being diagnosed, if it is not being properly diagnosed, what you have to do is go to the nearest OPD and tell your concerns, and the doctor will see you, and he will do the needful.
Yes. So madam, moving on to a different aspect, if we are a heart patient, if a heart patient is there, it's mandatory for him to maintain adequate and preferable cholesterol levels, and if a patient is suffering from chronic wounds, it's better to maintain his or her blood glucose levels. Likewise, when it comes to leprosy, are there any conditions that we have to control in order to suppress the the wide spreading of this disease?
No, in leprosy we are not talking about these things, because leprosy, if they are having any other diseases, co-infections, co-diseases
Right.
with them, most of the time there's no hard and fast rule, they can give the multi-drug therapy.
Right.
When we are starting the multi-drug therapy at the dermatology clinic, periodically we will be checking up that patient. Various kind of blood test we will be performing, and we are looking at the clinical features, and if there are side effects we will be looking at those things. Likewise we will be continuing the treatment. Therefore it is very important to go for the treatment and take the medical advices. If the patient is having any kind of a discomfort or anything, you have to go for your dermatology clinic.
Right.
And if you happen to go for take any other treatment from any other doctors, you have to tell, look, I am taking these drugs for this illness. Therefore there's no such a thing like that you have to control this thing to take this drug, leprosy drugs. There's no such thing. Anyone can be given this.
For leprosy.
Yes.
It's for leprosy, right? So there are certain conditions that will affect one the other, but there might be certain personalized conditions for you all that you have to consider. So all about leprosy is to identify any lesion or something appearing that is suspicious to you, any symptoms that you were talking about being suspicious of this condition, then immediately proceed to a physician, a qualified physician, without doing some things locally on your own, because that will worsen the condition. As the doctor said, it will deteriorate the original nature of the wound, certain local applications, and that will be a confusing stage for the particular physician to diagnose it properly, as because to diagnose the disease there are different aspects coming into commonly with common features. So we have to spot on and clearly segregate what this disease is. So make sure that it will be easy for the physician to diagnose. That is not because of the physician doesn't have that sort of a knowledge. That is because these multiple complexities of the human nature and these diseases, when overlapping with certain symptoms, it will be difficult, and at the end of the day you will be the person who will be following the negative impacts of what you have done. So as we always said, proper time, the proper treatments manifested on the early stage, it will be helpful to cure this disease. So thank you very much, Madam Dr. Dilini Vijayasekara, the consultant community physician of anti-leprosy campaign, for joining these honors to this discussion, and we'll be having more discussion in the future with the program IMED. Thank you very much for watching. Have a pleasant day.